Hi, my name is Dr. Priya Parmar. I'm a psychiatrist in Westlake Village. Here at Rise TMS, we use TMS, transcranial magnetic stimulation, to treat depression and other mood disorders. So what is TMS? It involves applying a magnet and a small electrical pulse to the part of the brain that we're trying to re-stimulate. What I want to convey to you is that TMS is a more comprehensive way to look at and treat depression than medications alone. Medications are great, psychotherapy is great, but the thing about TMS is we can treat depression as a dysregulation of a brain network, and the brain network is the salience network. The salience network is a loop of structures in our brain that deals with our external environment and our internal environment. It deals with how we harmonize the input of this information. Dysregulation in the salience network can lead to major mood disorders, including depression. So, when we apply pulses of energy to places on the salience network on the head, we can re-regulate and reroute the energy in those neurons. Essentially, it's like physical therapy for a part of your brain. It stimulates and it reconnects parts of the circuit that were not functioning before. It does this without side effects that medications have. It does this without dulling one's cognition. In fact, it can enhance memory, cognition, and it can sharpen our awareness of our environment. The salience network deals with mood and attention, executive functioning, and it's a very important part of our relationships. We affect the salience network through exercise, we affect it in our environment, we affect it in psychotherapy. We try to do it with medications, and we can do it with medications, but often there are a lot of side effects that go along with medications. If we could look at the neurons in the salience network, they might be a little blunted. They might be a little withered, all right? Now, with exercise, with lots of good psychotherapy, correct medications, they get stronger, they get better, but maybe they never reach the full robustness of a neuron communicating. With TMS, we can take it to another level. And that's why we have so much success with TMS and major depressive disorder. Transcranial magnetic stimulation is safe, it's effective, it's FDA approved, and it's a painless treatment for major depressive disorder and other mood disorders. We've talked about what TMS is. Well, what's the process for getting a treatment? Essentially, you show up at the office for a 20-minute appointment. It's almost like visiting the barber. You sit in a comfortable chair, you talk with the assistant, you could listen to music, you could watch TV. While you're doing this, the magnet is applied to your head and we pulse it. When the treatment is finished, you go home and go about your day, and you come back again for your second treatment. And we continue this for about 30 to 35 sessions. We have had dozens of successful outcomes where medications have failed patients. We've all heard of serotonin. We've all heard of dopamine and norepinephrine. And these are neurochemicals involved in major depressive disorder. Psychotropic medication looks at these chemicals and addresses the chemicals. TMS is different. TMS looks at the system involved in mood disorders and treats the innate system. You're not just getting a spot treatment of serotonin or norepinephrine or dopamine. You're treating the innate system in the brain with repetitive pulses of magnetic energy. It restores the connections of this network. TMS is a regenerative process of healing. And it works in people who have not been helped by medications or psychotherapy. If you've tried medications and have suffered side effects from them, it may be worth trying TMS. The worst that could happen is nothing. One of the best things about TMS is that it does not have side effects like some of the pharmacological agents used for the treatment of depression, anxiety, and OCD. You will not experience appetite changes. You will not experience a change in your libido. You will not get cognitive dulling. TMS is safe. TMS is effective. TMS is covered by most insurances. The worst thing that could happen is letting your depression get worse. Please give TMS a try. How do I start TMS? Well, if you have questions or you just want to get started, please give us a call at Rise TMS. We'll work with you and your insurer to get the maximum coverage. I hope to hear from you soon.